See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. Remember Michael Douglas?
Yes, I do.
Remember I don't know if his marriage is broken up when he said that his cancer of the head and neck area was caused by oral sex.
I remember reading that in the newspaper, all over the newspaper.
And they were kind of like broken up, and they were fighting to keep their marriage together over the comments about how he got this cancer.
That could cause some issues between the two.
Well, so now there's a study. I'm not saying it for nothing. We're not saying it just to be alarmist here. But there's this new study out that came out on January 30th. So is that new news?
Yeah.
Okay.
I mean,
so
that is day before yesterday.
Thursday, right?
Yep.
So the new study is showing an alarming increase in oral pharynx cancers. These are cancers around the mouth area in young adults. And it's felt that human papillomavirus. Now, human papillomavirus is a virus that's responsible for cervix cancer in many women, right? And it's felt that human papillomavirus may be to blame. So researchers in Detroit said there was a 60% increase in cancers of the tongue, tonsils, soft palate. So soft palate is a part of the mouth above the tongue, and pharynx in people younger than 45 years of age. And in white people, there was a 113% increase. So a tremendous increase. It's more than doubled. And this is young people, and usually head and neck cancers don't affect so many young people. And doctors said the growing incidence in oral pharynx cancer has been largely attributed to the sexual revolution of the 60s and 70s, which led to an increased transmission of high-risk human papillomavirus. And they were surprised to find there was a substantial increase in young adults with cancers of the tonsils and base of tongue. And now people who get human papilloma-caused cancers actually have a higher chance of being cured than other people who get head and neck cancer. So it's not all negative.
Okay.
There's expected to be 36,000 people with oral cavity and oral pharyngeal cancers this year, and about 6,000 are expected to die, which means about 30,000 of the 36 will not die. So that means about 80% of the patients will be cured.
Yeah.
So it's pretty hopeful.
Yeah, sure.
Someone came to me yesterday and said, do people with cancer really live? Are they cured? And the answer is yes. About 2/3 of people with cancer in America who have cancer, get treated, are successfully treated and do not die. Their cancer dies. They don't die. So yes, we can get the cancer, head and neck cancers, cancers in the mouth, tongue, oral pharynx, base of tongue. Give us a call, and we will talk about trying to get you treated in a way to avoid harm to the healthy tissues. This seems to be a new epidemic in America related to human papillomavirus, cancers of the oral pharynx, and there's an alarming doubling of the rate of cancer in young Americans. Scary business, right?
Yeah, for real.
Yeah,
Sure.
it makes you wonder.
It does.
So we have another patient who came in. I want to talk about this patient because I think we can learn about this patient and learn about ourselves. So this woman was 69 years old. She's divorced. She had 2 children. She came with her daughter and daughter-in-law. In 1991, she had breast cancer treated successfully. Okay, so that's 22 years ago.
Yep.
Never came back.
Yeah.
Which is what we're talking about. And then she had a colon cancer with bleeding. And she was treated at another hospital. And at the same time, when she was diagnosed with a colon cancer, she had metastasis to the lung. So she started some chemo because of the metastasis to the lung, and she had chemo for 4 years. 4 years.
Yeah.
And guess what's happened? We can know what's happened because she's with me now.
Yeah, it didn't get better.
It didn't get better. It got worse. And she has adrenal metastasis also, which we just spoke about. She has some pain in her waist area. Her weight has fallen from 130 to 107 pounds, so she's lost a lot of weight.
Yeah.
She's really slender. And she has massive cancer in the lung. I brought the picture of this also to show you. So you can see, here's the scan. And when you come to us, we'll show you all your scans so you'll have an idea of what you're treating. It's not the black hole. So here's the spine.
Mm-hmm.
And these white areas are the ribs. The black area is air in the lung. Just like outside the body is black, that's air.
Okay.
Okay, so it's not nothing, it's air. And in the lungs, it's mainly air, you can see.
Sure.
And you see that in large mass?
Right, yeah, I do.
It's like the size of a grapefruit.
I was going to say, it's baseball, yeah.
So it starts from the ribs and goes all the way to what's called the mediastinum. The mediastinum is the center of the chest. It's where all the blood vessels go to the heart and from the heart, and when the airway exists going to the lungs, that's the mediastinum. And again, that's not one of the areas you read about in National Geographic, but it's a very important area. So her cancer, she has a big mass, and she's short of breath. So she's in pain, she's short of breath. Now we can treat that and most probably stop it or shrink it. And again, the success rate is about 90%. So it's all non-invasive treatment. So I think she had 4 years of chemo and it didn't work.
Yeah.
And we could give her 5 treatments, each one about 15 minutes, and most likely it will work. It's like day and night.
Yeah, sure.
So it's incredible for her. So she came in this week, and we also started her treatment. We like to start the treatment quickly. We don't think people should sit and wonder and suffer at home while we can do treatment. So we'd rather work harder so that patients get a better chance to get better sooner. So this is another case. Colon cancer, metastatic to the lung and the adrenal, both can be treated with radiosurgery. We're starting with the worst area, the lung, and if she likes our work, we'll move on to other areas.
Good.
So a nice story.
Yeah, good.
And instructive story about how we can make someone's life better. Right?
That's it.
We had another patient. Now, this is what happens. You try to treat every patient right? So one of our patients we treated a couple of years ago had prostate cancer. Works in Midtown Manhattan, so very close.
Mm-hmm. Sure.
Came in every day for treatment. Treatment's 15 minutes. Was successfully treated and happy and felt comfortable. And now his wife has an endometrial cancer.
Okay, not too familiar with that.
Okay, you're familiar with the uterus.
Sure.
The little baby grows in the uterus, right?
That's right.
So she had a cancer of the lining of the uterus. Now, when a woman has menstruation, when she has her period, where is that blood coming from? John, come on. You're 25 years old. You should know these things.
Well,
It's not coming from nowhere, right?
no, that's true.
It's not coming from a faucet.
Right.
It's coming from the lining of the uterus.
Okay.
So for a woman, every month, her uterus prepares for the possibility of becoming pregnant.
Right.
That's what the cycle's all about,
Sure.
right?
Sure.
So the woman has an egg. The egg bursts open. It goes down the fallopian tube. It goes into the uterus. It's waiting for sperm.
Matchmaker.
It's waiting for the matchmaker
Right.
to get pregnant, to have a fertilized egg.
Right.
So the endometrium every month changes. It's quite a system, right?
Yeah.
So from when the periods start, maybe age 12 or 13 or 11, until menopause.
Right.
Every month, that lining develops.
Yep.
And if the woman doesn't get pregnant, it goes away.
Sure.
There's the blood, and that's
Right.
called the menstruation or the period. So that's the endometrium. Endo means inside.
Right.
It's a Latin word, and metrium's for the uterus, inside the uterus. So the uterus mostly is a muscle.
Yeah.
Because why is the uterus a muscle? Well, when the baby grows there, the uterus has to push the baby out.
Yeah, sure.
Right, so most of the uterus is a big muscle. So this is the lining of the uterus. Now, usually women who have endometrial cancer, because the endometrium is open up into the vagina, usually a person who have bleeding, they know about it early,
Yeah.
and the cancer is successfully treated because it's like early warning sign.
Sure, yeah. That would
Right.
certainly raise red flags.
So a woman has the bleeding, and they're saying this doesn't belong here. They go to the doctor. They usually have like a DNC, which is dilatation, which dilates up the cervix, and then pulls out some of that tissue,
Yeah.
examines it under the microscope, and that's how cancer is found. So this woman is different than most women. Why? Because she had vaginal bleeding, and she went to the doctor, no delays, and in this case, it was found to have spread.
Oh,
It
okay.
spread significantly.
Wow.
And she was in a lot of pain. She's seen other doctors. Her husband brought her to us this week. Even though she had pain, no one gave her pain medicine, so we gave her pain medicines. And we staged her. We found exactly where the cancer was. Other doctors did a CAT scan. They said, maybe there's something in the lung. We can't tell. We got better testing. We found exactly where the cancer was. And, in fact, it was in the lung, and it was in the spine, and it was in the scapula. And we're going to treat those areas. Now, we're going to treat them to try to avoid harm to the spine. We're going to get some of the tissue and grow it in a laboratory to find custom-made chemotherapy. So rather than give her any chemotherapy, which is where most places do, or they give her what's the usual,
Yeah.
we're going to custom-make her concoction to find out which drugs are most likely to succeed in her. And we're going to give radiation to the uterus after this biopsy to stop the bleeding and pain. So we were able to stage her. Others didn't do that. We're able to put together a custom-made concoction. No one offered her that. We're offered to give her focused beam radiosurgery, just hit the cancer, to try to take away the pain and suffering and the bleeding. And she was content that we're able to offer so many things when she just came for a fresh second opinion.
Yeah.
Because her husband had treatment 3 years ago and liked how he was treated. So it shows that people do respond. We know that. They do respond to good treatment and recommend us to their friends and here to the loved one. So we're going to hear from our sponsor, the man with the golden voice, in just a few minutes, as soon as we get back on track. So here is Russ to give us news from Dr. Lederman. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD.